Okay, here we are again in another episode, this time with Jesse Vogel. He is the CRO from a company called Prosperity EHR. And yeah, so super excited to have you here. Mindfulness, mental health, it's super important. I'll give you the floor, Jesse, so that you can let us know just a little bit about yourself. What is that you do at the company, and how do you guys change lives and corporations?
Sure. No, thanks, Louis. Appreciate that. I guess, yeah, I mean, the quick background and bio on me, I'm Jesse Vogel. I'm the Chief Revenue Officer at Prosperity EHR, which is just, I do sales related things. I spend a lot of time with our existing customers. I spend a lot of time with our prospective customers. It's all in service of helping them to maximize the value that they get out of our technology platform and the services that the wraparound services that we provide. So we also do revenue cycle managed services. My background really quick, maybe before I tell you a little bit about the company, I actually grew up in healthcare by the School of Hard Knocks at a large electronic health record vendor company called Epic, based out of Verona, Wisconsin. I graduated from college in 2002 and had the types of degrees that were not really business oriented, I guess I would say. I was more qualified, I tell people, for a career in retail or food service than I was in corporate America. But Epic, being a local company that was growing by leaps and bounds when I graduated, took a shot on me. And I'm forever thankful for that. That's for sure, because without having experience or professional experience in healthcare outside of being a patient, that was a big leap for them to take, and turned out to be one of the most, I guess, formative times, certainly in my professional career, because I learned a tremendous amount very, very quickly working with some of the best and brightest in a company that had a tremendously strong culture. It was kind of they were iconoclasts, or they were definitely iconoclasts, and still are in many ways. But it taught me that, the way it's always been done by, historically in business, and the way that successful companies operate isn't the way that it has to be. Epic kind of forged its own path and created its own identity and did things its way. And, I think there's a tremendous amount of good that company has done, and I was proud to be a part of it there for the 11 years that I was there. So I did training and implementation and things like that. I kind of meandered around in a couple of different parts of healthcare for a little bit, always kind of at the intersection of where technology meets operations and helping health systems, practices maximize their investment in technology. And that's actually how I came to become aware and get involved with the company that exists, or that I'm with today, Prosperity EHR, because it was actually a company that had been around for about 30 years. It was a different name for most of those years. We actually just rebranded the company this year as we rebuilt a significant portion of the platform. And really our mission is to improve access to and the experience of mental and behavioral health care delivery for all. And the for all is important, because that doesn't just mean patients or the people that the providers are helping. It means the providers too, and the support staff that are helping the providers to operate their practices. Really, everybody that's involved in mental and behavioral health care delivery, we have built, designed, support, and provide services for that entire user base. So patients, providers, support staff, practice administrators alike. So our mission in this world, knowing that there's the gap in access to care, that there is both a provider shortage, there are patients who don't get the help that they need. Our goal is to increase access to high quality mental and behavioral health care. And we do that, like I said, with our technology and services platform.
Yeah, and there's a lot of burnout. There's a lot of like admin work that could be automated, could be designed in a way that it understands the patients, it understands the admin stuff. So I think that's what you guys are encompassing and bringing a better solution, like rather than just like a cookie cutter or whatever.
That's right. And I think we're we're building this technology, we realize that behavioral health is a vast portion of healthcare that is really underrepresented in a lot of ways. Like there are not, historically there have not been full featured electronic health record systems built just for behavioral health. There are many of them out there today, and there are some really good ones, and they're built, generally speaking, though, for smaller private practices, 1, 2, 3 providers, and there's some really good systems out there for practices of that size. What there haven't been historically is more full-featured technology platforms to support practices that have aspirations to grow, that are adding services. So you're doing talk therapy today. Well, we want to add prescribers, or we want to bring on a provider who does neuropsychological testing, or we're interested in doing esketamine or Spravato treatment at our practice. Well, what does it take to actually do that? I mean, it's not just about adding providers to do that. You have to have technology that supports all of the administrative functions around that to be able to successfully offer those types of services. So what we've done is taken all of the things that we've learned about building a health record platform, an electronic health record platform, because I'm not the only one that has Epic background at this company. A few of the other folks do, including our CEO, Melissa Tran, is also an Epic veteran. And taking all the stuff, all the things that we learned about how to operate in healthcare, not just on the clinical side, but also on the practice management, on the revenue cycle side. Because at the end of the day, I think that the reality that these providers and the practice owners in behavioral health have to face is that the margins just simply aren't strong enough in behavioral health for many of these providers to be able to reinvest in their business, to add providers, to add service lines without having to add a significant amount of support overhead. And that's the math that we're trying to flip on its head with good, capable technology that is that includes automation, that includes smart, responsible, ethical AI incorporated into it. We can change the margins, we believe. And we're doing this with our customers now, and we're really just finding our feet and being able to tell the story about that. And we've had a lot of success as we get to know more practices that are out there and we learn about what they're struggling with today. It's a margin game for a lot of these folks. And if they want to grow their business, they've got to be able to invest. They need to invest in that piece of equipment to be able to do TMS. They need to be able to invest in other types of providers that, sometimes command a higher salary. They've got more education. There's just a different level of technology that's needed to support that. And that's what we're really excited about delivering for our customers, and where we really think we have a competitive advantage in the marketplace, because we believe that the features and functions that we're bringing to market are able to change the margins in a way that tip the scale so that these practices can continue to grow and provide more services that people really need.
Nice. So when it comes, and maybe this is a two-edged sword question, like I would like to have maybe some kind of KPI from a transformation of one of these practices, because if you're saying that you are making sure that the platform is ready for these practices to grow, you might have already some examples that you can talk about. And the AI capability might be a crucial role in the growth of these corporations, because they will be able to provide recommendations or things to action so that they can grow without being overhead and just being bogged down in a piece of software.
The morass of paperwork or chasing documents between systems that aren't connected. It's we hear about it every day. And as like I said, as performant as some of the competitive or the technologies for private practices are, as you increase the complexity, the software that's in the market for those size of practices leave a lot to be desired. And I think that to your point, some of the outcomes that we've been able to realize with our customers. We just did a case study or case studies with a couple of them recently. One of those groups, we were able to improve their net collection percent just by virtue of installing our software. We were able to improve their margin by 2%. So added 2 points to their margin. So if they were achieving, a 5% or 6% margin before, I can't recall offhand what the baseline margin was, but we actually increased their profit margin as a company by 2%. That's huge. So for anybody that is paying attention, or like practice owners who are looking at their bottom line here at the end of the year, it's December, it's like, what could you do if you had 2% better margin? I mean, that allows you to be able to change your business. Well, then what if on top of that margin change, you also got paid 10 days faster today than you did in the past? So if it takes an insurance company 30 days to pay off a balance that you send to them on a claim, what happens if you start getting payment back from those insurance companies on average in 20 days? So your cash on hand is better. Your overall margins are better. You reduce your denial percentage. Like most of our groups that we work with that use our revenue cycle system, they see less than a 4% denial rate or preventable denial rate on their claims. And that's huge, because in behavioral health, because the nuances are what they are with payers and insurance billing, the denial rates are ridiculously high. Like I was attending a conference in Nashville called the Invest conference, and there were people saying it used to be that if you had a 10% denial rate, you were kind of middle of the pack, maybe even the bottom. If you have a 10% denial rate today in behavioral health, you are top of the heap. Like, you are doing great. It's wild how it's changed over the last few years. Now, everybody complains about denial rates going up because payers are using AI to deny more things and find more reasons to deny claims. But for most of our customers, like I said, they're under a 4% denial rate. Like, there's one group I was talking to the other day. I mean, and their denial rate is down around 1 or 2%, because I talk about AI. There's a spectrum of AI, right? There's what's, known historically more as like RPA, or robotic process automation, which in today's terms is kind of known as reactive AI. So you define with a set of rules or criteria, conditions that need to be met in order for the system to automatically take some action. So that, in today's terminology, that's kind of the one end of the spectrum that's called more reactive AI. Well, then there's the other end of the spectrum, which is more, generative, predictive AI, way out on the other side. And there's talk about, how much AI should be built into healthcare technology, particularly into mental and behavioral health. And we could talk a whole lot about how generative AI is being used by, adolescents today and people in terms of like trying to connect with people and using it in place of therapy and what have you. That's kind of a separate subject. The way we are seeing real value be delivered today, and it's been for years this way in our system, is through reactive AI. And because we are able to look at in our system in real time charges that are coming from sessions where providers are writing notes, and update those charges with the appropriate charge codes automatically. We don't want our providers to have to be medical coders or billers. That doesn't make any sense. That's not them operating at the top of license. We can build in payer-specific rules to automatically update charges, make sure that what goes out the door is going to be reimbursed at the highest level and on the shortest time frame. So there's a lot that we can do with the reactive AI solutions in our software today that prevents a lot of denials or a lot of the missing revenue from happening in the first place, which is why we can increase margins the way we do. But now on the other side of it, closer to the middle of that spectrum, there's, summative AI, things that they can look, the AI looks at a massive amount of data, like looks at all of the session notes for a patient for the last, 2 years, 3 years. And it gives the provider a summary that they can read before they start their next session with the patient. How has this patient been doing? What do their PHQ-9 scores look like? What have you talked about in the last few sessions? What are maybe some ideas for questions to ask, or things to point out, or things to check in with the patient about? So there's features like that we're building in right now that are coming. The main thing that we're thinking about as we're building them, though, is one, is it ethical and is it safe to do? Because if it's not safe, if it is not ethical, especially when you're talking about mental and behavioral health care, like that is we have to make sure that we are 100% in lockstep with the best science at the time. So ethical, safe, it has to make the clinician's life and experience more efficient. So it has to contribute to efficiency and better patient care. And then also, it's got to be cost effective. So many of the AI solutions that are out there today, and we see it from some of our competitors, it's like, sure, we've got this generative AI thing that you guys can use. It's going to cost you an extra $100 per month per provider to use it. Like, it starts to become cost prohibitive for a lot of these providers because, again, to the point of margins, they're not good enough to be able to support all that added extra expense. So when we're thinking about building these solutions into our software, is it ethical? Is it safe? Is it contributing to better care and more efficient provider experience? And also, is it cost effective? Is it going to cost our customers any more to use it? And so we're balancing all of those factors as we think about incorporating solutions like that into the system.
Got it. So there's a lot of that maybe the 2% is a little bit conservative, because thinking of the clinician and the admin, they may be even saving more time than what they think, and then instead of fiddling around just resubmitting claims or things like that, they can just do other more aligned things in their practice.
That's right.
They can bring more revenue by doing, I don't know, social media, following up with patients. I don't know. Just
patient outreach. It's engagement. It's marketing activities. It's improving processes. It's the staff spending their time at the highest value and the highest value points of the whole chain of things that happen within a practice, whether that's onboarding patients, if it's following up after visits, if it's chasing after large balances that are outstanding with insurance companies. It's like, well, let's not chase after the large balance. If we know that we have a contract with that payer that says they're only going to pay us $80 on that $150 that we billed them, if we know the max we're ever going to get for that service is $80, well, let's go after something that we know we're going to get 100 or 110 on what we built. So it's giving the users, the folks that are using the system, better insights in the moment, so that they can make better choices about how to use their time. So I totally agree with you, and I think, and I cite that the improved margins that our groups typically experience. What that number, like increasing margin by a couple of points, doesn't account for is the fact that our technology is built so that when a practice adds providers, they don't have to add as many support staff proportionally. So when you talk about cost savings and operational overhead savings, well, what if if today, every time you add 5 providers, you have to add a support staff, somebody that can do the intake process, somebody who's going to be able to manage all the things that it takes to keep 5 providers running and operating at a high level. Well, what if you change that number to 10 providers to 1 support staff, or 20 providers to 1 support staff? Like, again, it's a cheat code, right? The technology, if it's built properly, if it's installed properly, if you've got the expertise to help you use it and optimize it along the way, which is the other thing I think is a differentiator for us, because we've operated in healthcare for a long time. We know where the bodies are often buried. Like, we know where to go to figure out where the efficiencies can be gained and where we can use technology to automate away the rudimentary tasks that people shouldn't have to spend their time on, we believe that we can save practices, not just tens, but hundreds of thousands of dollars a year.
Yeah, for sure, and especially one thing to add into the mix of the KPIs is the if you recall some of the reviews of any medical practice, like there's no medical practice that don't say that the doctor didn't remember what I said last time when I came in, which is exactly what you said. And some of these people, if it happens one time, okay. If it happens two times, like they're gonna go with someone else. Like how do you calculate the ROI there? So if you have this patient experience where you have a summary before, I'm not talking about the ethical. Let's see the practical or the practicality of this example. Like for me as a patient, I'll not go somewhere else because I'm having exactly the care that I need, and I know that the doctor, and it's mind blowing. How could he remember? Like it doesn't. He's not remembering. He's just reviewing 3 paragraphs before I get in.
That's right.
And they will retain like 97, 100% of their patients.
That's right. I mean, and it is definitely we've heard it over and over from our customers and from the providers who are seeing patients that the number one most important aspect of quality care is the connection between the provider and the patient. And if you, to your point, feel like that connection isn't there, if you brought up something in prior visits that is not, the provider isn't honoring that, doesn't remember that, it's not included as a part of the follow-up, you're thinking to yourself, there's not a connection here that I'm comfortable with or that's meaningful enough that's going to keep me here, which means that you have to start over as a patient. It takes longer. Like we're not helping people. So yeah, I agree with you. I think if the technology is built right, we can both strengthen the connection between the provider and the patient, and we can change the calculus on the margins. Like we can take what are already slim margins in mental and behavioral health and improve them to a point where these practices are able to reinvest in their business, reinvest in their people, because providers burn out. They don't feel like they're appreciated, well paid enough. That it's a hard job. Like it really is. And, compartmentalizing what everything you do from patient to patient and going through that all day, if you feel like you're just fighting technology every step of the way, you can only do that for so long before you're like, forget it. I'm okay with just working at a, basic 9-to-5 job where I don't have to think. I'm not called upon to do all kinds of deep processing in order to be successful. So we feel like it's a part of our responsibility to design systems that make it easy for providers to take the next appropriate action. So helping them along the way, because there is a lot to remember when it comes to compliance and regulations and all that stuff. Well, what happens if the software is designed in such a way that it says, hey, you got a treatment plan that needs to be reviewed later this week. Here it is. Here's a quick way to jump in there, review this thing. Today, a lot of that, a provider just keeps it in their head, or they write it down on a Post-it note. They stick it on things. And like, if you look around many of those providers' offices, you see what's behind them and it's like, oh, that looks neat and tidy. And then if you looked at their desktop, at their notebook, it's an explosion of Post-it notes and other things that they're trying to get that information in their head out and to organize it in systems so that they don't forget. Well, that works a lot better if the technology is designed in such a way that it takes all that stuff from the desktop and it organizes it for them in a way that makes sense, that helps guide them to that next appropriate action. The cognitive burden that is relieved by well-designed, thoughtful technology is significant, and it really can make a difference in provider burnout.
Yeah, burnout, mental health. Can you imagine how many practices, like you mentioned the 9 to 5, but there will be other people that they don't want to grow because they know that, oh, if I grow the thing, I'm not going to, I don't care. I will retire in 10 years. I'm okay with this space that I have and whatever, without knowing that there's something out there that can help them to alleviate and offload all the mental burden that they have and just make their lives easier and be able to grow.
You got it.
So that's I think that's in my opinion, if I could say that that's where AI is going. AI is not going to replace the provider. AI is not going to replace the desk admin, but it's going to make their lives easier. That's my yeah.
No, I think so too. I think we just have to figure out, and we're seeing it already in some features and functions that practice or that are becoming available. So things like AI scribes, ambient listening that helps to collect the information or the conversation that a provider and a patient have and organize it in a way that it can hopefully become structured data, become a part of a note. I do think that there's value in things like that. I think how that information is handled, how it's transmitted, how secure is it, et cetera, like that, those are the things that we're all, wrestling with right now, and things that providers really need to pay attention to before they invest in solutions like that. Because again, that patient provider relationship is sacred and it is private and it needs to remain so. So I think that, safety and security, what I talked about earlier, as we think about AI, are the first and foremost. Is it ethical? Is it safe? Mm-hmm. That's the first questions that have to be answered.
Beautiful. And we run out of time. I would just close up with that, and I'll thank you very much, Jesse, for this great episode. Honestly, it was amazing to learn about this kind of initiatives and this SaaS businesses that it's not just about helping like the user, and you guys have a deep understanding of your user, and it was great to discuss like what you guys are doing to change the world one practice at a time.
Yeah, we're getting after it. We're trying to make the world a little better place, like everybody else. Yeah, it was fun. Thanks, Louis. I appreciate it.
Yeah, is that okay if when someone wants to contact you, if they watch this, LinkedIn is a good place?
LinkedIn's a great place. Yeah. Okay.
I'll put in the link and I'll tag you in as well. And thank you guys for watching. I'll see you in the next one.
Sounds great. Thanks, Louis.